Hello everyone, I'm Liz Brown. Welcome to Up Close. We are going to have a close-up conversation with a fascinating doctor from our community who has written this book, which takes us deep into the world of disease. It is truly a page-turner. I couldn't put it down, and it's wonderful to have him here in our studio. With us now, the author, Dr. Spencer Nadler. This book was just reviewed in the New York Times, and it's doing great.
Right.
Thank you for being here.
Nice to be here, Liz.
Tell us about this book and about you and how it all came together.
Well, I didn't start off with the idea of writing a book. I was writing personal essays, personal stories that were getting published in small journals, and a couple got published in Harper's Magazine, and one of them went to Reader's Digest, and I guess it got around enough so that an editor from Random House called me and said, how would you like to put these into a book? And that's how the book came about. So there was no intention really of planning a book or thinking in terms of a book. And as a result, these are very different pieces. But they have a very similar theme throughout, a similar main theme throughout, and that is the quiet heroics of everyday people in the throes of serious illness. Mm-hmm. And these are 8 of the most remarkable patients that I've come across, because all of them in their own way were able to compartmentalize their illness and in some way figure out how to go on with their life. And
as you said, I think in the book, the diagnosis of having a disease in a way is almost the easy part. It's that struggle to survive and deal with it. That's
exactly,
so huge.
Exactly.
Your background, what brought you to the book, of course, you were a surgical pathologist for 25 years here in the community.
Right.
And in a sense, you're a doctor's doctor, right? You deal with biopsies and reading cells, and you're under a microscope all the time, so you don't really deal with the patient. This book, you're with the patients. How did that whole come about, where you made that transition when you're working with patients?
Well, I trained partially as a surgeon to begin with, and before going into surgical pathology. And one of the things that I missed in surgical pathology was patient contact. And so I never hesitated when there was a situation that, for instance, a family or a patient was more interested than most in exactly what illness they have, and I had done the biopsy. And so from time to time, this type of patient would come to my office and consult with me and try to get, and hopefully got, more information than the amount that was given to him by the surgeon. And the first story in this book is a woman who comes to my office because she has a diagnosis of breast cancer and she wants to see her cells.
Hannah.
And, Hannah Balin.
And she could be a writer herself. I mean, her metaphors that she uses, I think when she looked at the slides and saw her cells, she described them, the abnormal cells, as looking like hula hoops. And the breast tissue that's normal was like a flower. I just thought, wow, I never thought about my cells like that or cells like that.
Right. That was a wonderful interaction in retrospect. I think I even appreciated it right then. I was, as I will usually do, we use a two-headed microscope so the patient can see what I'm seeing, and I have a pointer and can point to various cells and structures. And I showed her a normal, part of her normal breast tissue that was in the biopsy. And I said, using the pointer, this is a lobule. This is where milk is made in the breast? And she said, oh, these are pink hydrangeas. And then I said, well, these are the ducts now that come from the lobules and go to the nipple, and these ducts transport the milk in the pregnant breast to the nipple. And she said, my God, these are rivers, these are estuaries, these are ponds over here. So she had her own metaphors, and I realized that it was my job to shut up, really, at this point, and let her form her own metaphors. There was no room for pedagogy in this situation. She was here to see what she could see, but to interpret it in her own terms. Mm-hmm. And that's exactly what she did.
And but in the writing, in the language of cells, I was looking at all the reviews, and they keep saying pathologist or poet. Even the ability of the way you put these stories together and the words that you use, it's just so beautifully put. And every story is so inspiring. And I think, at least for myself, you can find yourself in all of these stories, because this is about the human condition. Take us to the story that really fascinated me. I have to say, I had to deal with, because I'm always battling my weight, was about morbid obesity. Talk about the case of this woman who you dealt with that was very overweight.
This is a very brave lady. Her name is Patty Fleming. And she wanted her story to be told to everybody. And she didn't want me to use another name, to protect her a little bit, or another description. She wanted her description and her name, and she was proud of this story. And the story is that of a woman who weighed 357 pounds at age 42. And her doctors told her simply that she's not going to live to see her children grow up. She already had hypertension. She already had diabetes. She already had severe arthritis of her hips and lower limbs, all as a result of this massive weight that she was carrying. And in telling her story, she allowed me to see the tremendous amount of prejudice that is involved when you are the morbidly obese person. People look at you, and you don't have to say a word. They know everything. You're fat because you're lazy. You're fat because you eat too much. And when she would go into a restaurant, for instance, with some people at her work, they wouldn't even get to her, or they would certainly get to her last to find out what she wanted to eat. It was almost as if the waiter was saying,
you don't need any more food.
Lady, you don't need any food. And the story really is filled with a lot of these anecdotes, the tremendous difficulties she had with dieting. She would take off weight and then balloon back and forth. And she fought this for 20 years, from age 20 to age 40. And finally, she saw a doctor at UCLA who suggested a surgical procedure that is not a cure, but it's a tool. And what it does simply is make the stomach quite a bit smaller and bypasses some of the small bowel, which is responsible for absorbing the calories, absorbing the fat. And nobody in her family, none of her friends, wanted her to do this. Come on, Patty, you can do it. One more diet. Come on, give it a try. You don't want to go under the knife and have the surgery. But she realized she had to do that. She really couldn't make her way any other way, and her life was being threatened. So despite all this negative comment from all those around her, she went ahead and had the procedure. And basically she gets her life back. She gradually loses weight until she settles at 169 pounds. She's a tall woman, and she looks beautiful. Mm-hmm. So it's kind of a very happy ending, and she goes back to all the, she's an athlete, and she goes back to all the athletic events that she used to as a child, and she gains her confidence back, and her hypertension disappears, and her pain in her hips and lower limbs disappears. So it's that kind of story. At the beginning, you get a sense of the terrible prejudice, and at the end, you're sort of cheering her on as she loses that weight.
For me, I think it also though teaches tolerance on the issue of obesity, because it's more than just overeating. I mean, it has, to me at least, I got out of this that it was the information that you gave about fat cells and how some of us can be genetically predisposed with not the best fat cells. I don't know. In her case, was that a big part of what happened to her?
Well, I think you
have to overeat to be that size.
Yeah, I'm sorry?
Do you have to overeat as well? It's not.
Well, you do. It's a combination of two things. One, there is a theory that we have some sort of thrifty genes in us. Our ancestors needed these thrifty genes to be able to survive from feast through famine to the next feast. And that we have inherited these thrifty genes at a time we don't need them. We have a surfeit of food, fast food. Food is all around us. And so those of us who inherit more of these thrifty genes are at a disadvantage today. And they seem to gain weight doing the same amount of exercise and eating the same amount of food as somebody else who has less of these genes. And she describes being at camp when she's a teenager and being an athlete and exercising at least as much as everybody else and eating the same food and the same amount of food, and she realizes she's getting fat. And I think this is something that we must know more about. We don't really know what these thrifty genes really are, but I think that's something that we'll soon be able to find out. Mm-hmm. And I think that's an encouraging sort of a thing to look forward to. The other thing is we don't know that much, and I'm talking about the lay public now, about what being fat really is. Is it that your cells increase in size? Is it that you gain more cells? As it turns out, it's a bit of both. Do you want me to tell you about that?
Sure.
Okay. When we're born.
Since I'm always on a diet.
When we're born, we have about 5 billion fat cells. And for the first 6 months of our lives, these cells are impacted with fat. And so they grow in size. Then from a period of 6 months to late puberty, the cells increase in number from about 5 billion to about 35 billion, which is the adult amount of cells. And you get fat by increasing the amount of fat in your cells. If you have 35 billion cells, and each of your cells quadruples in size, just think of the massive increase in size of your fat organ. Mm-hmm. It's a tremendous amount. Now, if you do stress your fat cells to this degree, it does stimulate production of more fat cells as well. This is less of probably less of an important feature. The more important feature is increasing in size of your fat cells. But it's there. So you do increase in cell number as well. And once these fat cells are impacted, it is very, very hard to get the fat out, so to speak. Mm-hmm. And morbid obesity, Patty Fleming was morbidly obese, means somewhere around 100 pounds or more over your ideal body weight. You cannot become morbidly obese without overeating.
Right.
Even if you have a tendency to get fat, to gain that much weight, you're overeating.
Well, like you say, that for her there was a happy ending.
For her, there was a happy ending because when she had the surgery and reduced the size of her stomach and decreased the area in her small bowel where she could absorb this food, she was able to use this tool to reduce weight. What it basically does, quite simply, is not allow you to eat very much at any one sitting.
Mm-hmm.
Now, you can get around the situation if you want to eat 12 times a day and not lose weight. But if you reduce the number of meals to a normal number of meals, or maybe a few more than that, you can only consume food about the size of an egg.
Yeah, I was surprised at what the pain she'll be in if she
eats more or she doesn't chew.
Right.
30 to 40 times her food, 30 to 40 times.
Mm-hmm.
She gets what's called the dumping syndrome. The food prematurely gets into the small bowel, and it can be very serious.
Mm-hmm.
There's dizziness, heart palpitations, severe cramps, and you can even lose
Mm-hmm.
consciousness. So with Patty, this happened once and never happened again.
Right.
So.
Well, she is a fighter.
She's a
Everybody
fighter.
in this book you've written about, I mean, are fighters, including your dad is in here, and you talk about your own personal situation with your dad
Right.
with Parkinson's. Why don't you elaborate a little bit on that, on what was going on with your dad and what you were trying to portray with his story?
Well, I agree. Everybody in this book, everybody that I write about is brave in their own different way. My dad, for me, this part of one of the essays called Brain Cell Memories is really a memoir. It's a memoir of my dad, as I remember him. And he was healthy until he was 80, and I was back home in Montreal celebrating his.
Canada?
I grew up in Montreal, and I went back. Most of my family is still there, and we celebrated his 80th birthday. And he was just fine. He was a healthy 80-year-old. And a few months after that, he was diagnosed with Parkinson's. And I went back every year. He lived for 7 years after that. And every time I went back, because I wasn't with him all the time, I could see the losses each year, the deterioration.
And you also know what's happening to the cells inside him, too, which when
Yeah,
you look at him, you must see that.
Exactly. And this often happens to me. I can look at him and know that his substantia nigra, which is where the Parkinson cells, or the neurons that result in Parkinson's, are located, I can picture what's happening to his substantia nigra. I've seen many, many, many pictures of these changes. And so, in addition to seeing him in a position where he's deteriorating, I'm also transposing, if you will, his substantia nigra onto this story and seeing how that is deteriorating along with him. And I think the poignant part of this story is how he freezes. His Parkinson's, and everybody's Parkinson's is a little different. His was not tremors, as one commonly thinks of Parkinson's, but his was rigidity of all his muscles in his body. So, to give you an example, he lost his smile. He couldn't smile. And this took some of his personality away. You really also didn't know exactly how he was feeling because he smiled a lot. And I say in the book that I relied on that smile for encouragement as I was growing up. So it had been a very important thing to me.
It seems like you got the smile. You got his smile I don't know him, but you have a great smile, so.
Well, the interesting thing is I'm told that I have his mannerisms. I certainly have his looks. They're kind of, we look very similar. And people, now that he's gone, and when I come to Montreal, people kind of look at me in funny ways. And what they tell me afterwards is, you know, it's just incredible how your mannerisms, your looks remind us of your father. And whenever you're here, it's almost as if your father has come back.
What do you think he
which
would
is a very
have liked about
touching
this
thing
book?
to me.
What do you think he would have liked about your book?
I think he would have liked his story because I tell, quite frankly, how heroic he is as he's deteriorating. He can't play his beloved golf. He was a scratch golfer because he just doesn't have the physical capability to do that anymore. He can't even play bridge because he can't hold the cards with his hands. Mm-hmm. And it's a slow deterioration. And I think he would have liked that. I think he would have enjoyed the stories. I think he would have been very proud.
Right.
So I think about that a lot.
And about for your own self, for your own worry, are you at risk then too for this disease? Are you thinking about your own cells all the time and what they're doing?
Not all the time, but my grandfather, his father, had Parkinson's disease, and one of his sisters had Parkinson's disease, and then he had Parkinson's disease. So we are a Parkinson family, if you will. Mm. Whether we're at risk or to what degree is really hard to tell. There are very few Parkinson's mutations that are known. Some are known, but none in Ashkenazi Jews, like us, like our family, yet have been discovered. And so I've given a sample of my blood, and whenever a new family, Parkinson's family, is discovered, they check for a mutation, and if they find the mutation, then they will check my blood along with many, many others mm-hmm. to see if that mutation is there. And it's, you know, it's a difficult thing. Do you want to know or do you
right.
not want to know? And I think it, you know, I'm old enough now that I would want to know if this is going to happen.
Which brings me to one of the next stories, and that is the Alzheimer's patients in here. And I know now there's so much they can tell you, like you're on your way, and their story is very compelling as well. Talk about the 2 Alzheimer's patients in here, and I know you're working on a follow-up book, and I think you're going to continue with them, possibly.
Possibly continue with them. This is a professor of sociology at UC Santa Barbara, who is diagnosed with Alzheimer's, and it's diagnosed clinically, but UCLA now has a PET scan, positron emission tomography scan, which is a means of actually confirming both Parkinson's and Alzheimer's and many other things. And he was confirmed on the PET scan, and he was clinically diagnosed as having Alzheimer's. He was 58 at the time, still a young man, and very depressed, naturally. And he got himself onto an Alzheimer's chat room where he met a woman from Montana, lived on a ranch in Montana. And she seemed every bit as bright as he was. And so he was intrigued with her, so intrigued, as a matter of fact, that he went up to Montana to visit with her. And they fell in love.
And you got a love story in here.
I got a love story, an unusual love story. And they are now living on her ranch in Montana. And he says to me, we email back and forth a lot. He says to me, well, I know that someday we're going to be climbing Mount Everest, but for now we're doing just fine. And they're still doing fine. He has been an educator all his life, and he's still continuing to teach. As a matter of fact, he wrote a paper and delivered it to the Alzheimer's Congress in 2000. Mm-hmm. And she has a wonderful column that she writes on the internet. It's written daily, and it's about her experiences every day. And every day something else happens, you know, as a result of her Alzheimer's. One of the fascinating things that happened to her is she loses a sense of things. For instance, she was cooking one night, right, and there was a green vegetable.
Broccoli.
It was broccoli. It was broccoli, and she suddenly didn't know what it was. Now, it's not that she forgot the name broccoli. It's that she had no sense of broccoli-ness. She didn't know what it represented, what it was. Mm-hmm. And eventually, she figured it out with his help. And she gets periodic situations like that where she suddenly doesn't remember. Her son was one of the situations, her son Mike. At one point, she looked at him, he was coming towards the house, and she said, "I think that is Mike, but I've lost my sense of Mike-ness. I don't know what Mike means. I know he's my son, but I have no sense of this." And
it's
then,
scary.
Yeah, it's very scary. And sure enough, as he came close, he said, "Hi, Mom." Mm-hmm. And she knew that was her Mike. But
we only have, believe it or not, a couple minutes. And I think one of the stories, I know you've written about a boy with sickle cell disease. I mean, you cover it all. I think all the conditions we worry about. Could this happen to me? But it seemed one of the stories to me I got that you were really excited about was the story about the American Youth Symphony maestro who has heart problems. And last minute or so, because we'll tease our viewers so they'll have to read this book to find out all about his case. But talk about that, the story.
This is Zubin Mehta's father, Meli Mehta, who in his own right is a conductor. He is now 92, and when I did the story, he was 89. And he was introduced to me by a medical colleague, a cardiologist, and he has pretty severe heart disease at this time. He's had a number of heart attacks, and he's had bypass surgery. And what happens when you have a lot of heart attacks, your heart gets scarred. And when it gets scarred, you start to get arrhythmias. Some people get arrhythmias. And that's what he developed. Arrhythmia is a lack of normal rhythm. So I thought it would be very interesting to explore the difference between his heart rhythms and his musical rhythms, the connection between his heart rhythms and his musical rhythms. Well, that's what that was the intention. What I came up with is a wonderful 89-year-old who felt that the connection really lied in his whole life, and therefore he told me his whole life story, musical life story, mm-hmm. and how he started off in India and ended up here and has been conducting for decades, and despite his heart disease. And we actually have a tape that he gave me where he had an arrhythmic attack at intermission while he was, standing and receiving the applause of the crowd. Mm-hmm. He had an arrhythmia. And so the story really is all about what happens when he develops that arrhythmia. His son Zubin had come in from Florence to surprise him for this concert. Mm-hmm. It was his last farewell concert.
You definitely keep the readers on the edge of the seat thinking, what's going to happen to him? Is he going to make it through the show?
Right, it is a little suspenseful.
Feeling of urgency, and we actually do have a few more minutes here. I'm getting the stretch, so that's good. What do you want people to know about this book, about, when they read it? There's lots of other stories that we haven't really gotten into that are...
Right. Well, I think it's a book about, it's definitely written for lay people. The medical jargon is stripped from it. And it's a book about how people handle illness. And I've selected 8 of the most remarkable people, in my opinion, because they were able to handle their illness in a very brave way. in some cases a very sophisticated way, and we're able to go on with their lives. And each story has that, and I think that this is compelling to a lot of people.
Well,
It certainly was compelling to me.
Well, it was compelling to me as well. Thank you for sharing The Language of Cells, Life as Seen Under the Microscope. Pick it up. LA Times bestseller. It's understandably why. It's a terrific read, and I appreciate you being here.
My pleasure.
That's going to do it for
was
this
enjoyable.
edition of Up Close. I'm Liz Brown. Have a great day, everybody.